Chapter 4, Medical, Legal, and Ethical Issues. Okay, laws differ from state to state, country to country. If you're in America, you've got state laws, you've got federal laws, you've got all sorts of different jurisdictions and things like that. These things you have to bear in mind. It depends where you're working, what you're allowed to do and what you're not allowed to do. But the main concept of the whole thing is, above all else, do no harm. Okay, we need to do right with our patients. We need to try and treat them. I always try and remember the 4 Ps: preserve life, prevent injury from worsening, okay, promote speedy recovery, and in some certain cases, pain reduction. We need to provide all care in good faith. In other words, we're doing it out of the goodness of our heart. We need to provide proper, constant care, to be compassionate, to have empathy, to have sympathy, okay, and to maintain your composure and your professionalism at all times. We can't let emotions get in the way of our judgment and our ability to do our work. Okay, if you're employed as an emergency responder and you're dispatched to the scene of an incident or illness, accident, you have a duty to act. You need to proceed quickly to the scene, provide emergency medical care within the limits of your training, within the parameters of your scope of practice, and with the available equipment that you have. Failure to respond or render necessary emergency care leaves you and your agency vulnerable to legal action. Now, I must tell you, if you're doing this on a voluntary basis, you don't have to do anything you don't need to do. Safety first, paramount. Standard of care is in a manner in which you must act or behave. Really boils down to 2 things. Treat the patient to the best of your ability, provide the reasonable care a prudent person with similar training would provide. Reasonable man is the term that comes to mind. Okay, just remember that a reasonable man has time to think about what he has to do. Your time is limited when dealing with emergency situations. The scope of practice or the scope of care is defined by the U.S. Department of Transportation's Emergency Medical Responder Educational Standards. If you're in a different country, the standard operating procedures of the company you're working for would be your scope of care. If you're doing it as a first aider or a first responder, out of the goodness of your heart, then your scope of practice would be what you were trained to do. So you don't do anything other than what you have been taught to do. Always remember, if you step over the line, there's a good chance that somebody's going to slap you with something lawful. Okay, ethical responsibilities. Treating a patient ethically means doing so in a manner that conforms to the accepted professional standards of conduct. It's up to you to stay up to date with your skills and knowledge. That's why we do refresher training. That's why your certificate is only valid for 3 years. It's up to you to review your performance and assess your techniques. Constant practice and things makes you better at doing what you need to do, makes your skills sharper, makes you respond quicker, and breathe less doubt in your mind when you do things. Okay, response times comes with training. The more you do, the quicker your response is, the quicker your treatment will be. Try to follow up the patient outcomes. See what's happening. If you have a means to find out what happens, what becomes of the patients, please follow up. See, the more you know about how far your patient's progressed and how well he's doing, the better you feel about what you're doing, and the more you can reassess if you maybe should have done something differently or helped in a different way or tried a different technique. Everything helps. It's an ongoing learning process. We never ever stop learning. And then that brings the next one is participate in quality improvement activities. This could be anything from individual training, further education, ALS, things like that, whatever you can get to do, short courses, those kind of things. Ethical behavior requires honesty. Always provide a complete and correct report to the other EMS providers. Never change your report except to correct an error. Tell the people what you've done, even if it's wrong, okay? Because it might be able to could be corrected with a small maneuver that somebody else knows how to do, or a small thing, or it will give the EMS services a more accurate understanding of what's going on at the time. Okay, with your patients and their patients' family, it's important to be honest with them at all times, even if it means being brutally honest. Just be brutally honest in a nice way. If things don't look really good and there's not much chance of surviving or something like that, instead of lying, just say things don't look good, but help is on the way, or help is around the corner. Just hang in there. Okay, but never lie, because if you lie, you always have to remember what you said. Consent for treatment. Now, consent is always important. This is one of the first things we're going to do when treating a patient. Okay, express consent means the patient has willingly understood what you said. Okay, he hasn't been coerced into doing anything. He's had time to consider what you've told him, and he has the rational mind to give you an answer, yes or no, to treatment. In other courses I've taught, there's a very good way of putting it. Okay, information, volition, and capacity. Information: inform the patient what you need to do. Inform the patient what's going to happen if he doesn't have the treatment. Okay, and inform the patient what you think the outcome would be from your treatment given. Volition, meaning capacity or mental capabilities of understanding, rationalizing what you've been told. Okay, understanding completely the outcomes, the intended outcomes, and then the capacity to actually give an answer, a yes or a no, that your patient would be left with no doubt in their mind that they're doing the right things. Sometimes this express consent could also be called informed or actual consent. Okay, just remember that the patient must be of legal age to be able to make a decision, must be of sound mind, judgment. Okay, if the patient is underage and emancipated minor, they have to be, it's defined by the state laws. In certain cases, the child doesn't think the parents are capable of raising them, and they would become emancipated. They would free themselves from the control of their parents or guardians. Implied consent is pretty simple. Patients does not significantly specifically refuse care, emergency care. Do not hesitate to treat unconscious patients. Let me explain a bit. Always for implied consent, we would assume that the patient would want our help in a situation where they can't talk for themselves, or they're unable of making a rational decision. We would treat for these people. We would treat them anyway and obtain the necessary consent afterwards. We think specifically of hypoglycemic patients. Okay. Patients with head injuries that aren't able or to think clearly for themselves, unconscious people, choking people, things like that. People that cannot possibly do something for themselves. Okay. Consent for minors. Just remember, wherever you are, laws are different in certain places when it comes to treating minors. All right. If in a situation where the minor is unable to speak for themselves, or the minor is not got any guardians around, maybe the minor's choking, minor's drowned, something like that, having an asthma attack, one of those life-threatening conditions, we would always treat these minors under the implied consent thing and then worry about repercussions afterwards. We would assume, although assumption is not always a good thing, we would assume that the parents or the guardians of the minor would be grateful for you helping their child, especially in a life-threatening situation. When we're treating minors, okay, it's always essential that the legal guardian consents to the treatment. If permission cannot be quickly obtained, like I said just now, do not hesitate to give appropriate care. I'm talking about life-threatening conditions. I'm not talking about a graze on the knee that you need to put a plaster on or things like that. We don't withhold emergency treatment. We don't withhold treatment of any kind for life-threatening situations. Okay. Consent of patients with mental illnesses. Now, this is rather a sticky situation because remember, I always say mind safety is more important than anything else. Now, if we have a mentally unstable or a mentally impaired person, do we treat this person? The absolute answer would be yes, but I would definitely ensure that my safety is guaranteed before handling anybody. The possibility that you would need to restrain the patient is a very, there's a very definite possibility for that. Use law enforcement, whoever's available to help you and restrain the patient. You can't restrain the patient on your own, rather wait for backup. Okay, restraining patients is a very difficult thing to do. Okay, remember, mentally ill people are quite strong. Okay, now there's this thing about refusing medical treatment or care. Everybody has the right to refuse medical treatment, especially if they think they're being done wrong or coerced, being forced into it. Okay. You need to explain to the patient that what's going to happen if he doesn't get the treatment that he's been offered. You need to explain to the patient that the potential risks involved with not being treated. Okay. And you also maybe want to try and explain alternative treatments that might help them. If, of course, you think the person is crazy or has mental altered mental states and things like that, then with caution and restraint on behalf of the patient, I would go ahead and give treatment, but then I would definitely have my ducks in a row. I would definitely have reason to believe that they are mentally unstable and that they should be treated, otherwise they're going to hurt themselves. Okay. If a patient refuses treatment, I would, and he has genuine reason to refuse treatment, I would make a record, okay, and sign that record, stating that the patient refused treatment, on what ground you refused the treatment, and what your actions were. Make a note of it and turn it into an official document. Now, there's this thing about advance directives. Advance directive is a document that specifies what a person would like to be done if she or he becomes unable to make his or own medical decisions. A living will. A living will is a drawn-up document between a patient, a physician, and a lawyer. It is a legal document. It states the medical care the patient wants or wants to be withheld. Now, those type of things, if you arrive on a scene in an emergency and the patient is unconscious and somebody shoves this piece of paper under your face, okay, unless you're a lawyer that can actually verify what the thing is it legal, is it just, is it something somebody's made up, okay, I would treat the patient to within a standard of care and then wait to be ordered by somebody with a higher qualifications not to do the thing. A DNR, or do not resuscitate, usually is a person that's got cancer or something like that, some type of terminal illness. They've been through a lot and they're just waiting to pass on. And those are the type of people you expect to find with a DNR. Okay. Durable power of attorney for healthcare allows somebody else to make decisions on behalf of the patient. Okay. There are other terms involved with this, MOLST or POLST. Okay. These just are certain types of directives as well. If you're unable to determine if the advance directive is legally valid, like I said, begin your treatment, okay? Sometimes you can have a bracelet that identifies these related directives and things like that, like a medical alert bracelet or things like that. Just be careful. If you don't think it's legal, just treat the patient anyway. Okay. Now, the only time you're really going to get yourself into trouble when helping a person voluntarily is if you start treating the patient and then decide, well, it's time to, the patient's not going to make it, it's time to get out of Dodge City, or you've decided that you've done your best, but the ambulance isn't coming, and you want to go, you need to go now, then it's time to leave. No, once you start your treatment, you need to continue with that patient until you've been relieved by somebody who has as much training as you, or at least somebody that's higher qualified than you are. And when you hand over that person, you need to give them a full account of what's going on. Now, sometimes we can't treat because the patient is dead. Now, I always say this to the students, and I'm going to say it again now. The patient can either be dead or they can be dead. There is a difference. Now, dead would refer to positive signs of death. Decapitation and mutilation. If the guy's missing arms and legs and got a half a body and his head's beaten in, okay, those are obvious mortal signs of death. That is dead. Okay, there's no ways. Nothing that you can do is going to bring that guy back to life. Okay. Once rigor mortis is set in, rigor mortis is when the body goes all stiff. All right. The body produces enzymes that keep the muscle supple and things like that while they're alive. When the patient dies, these enzymes stop being delivered to the muscles and things, and the body starts to get stiff. We've all seen it. We've all heard about it. There's horror stories about it. But rigor mortis is a really advanced stage of death. It's dead. As is tissue decomposition. If the patient is starting to smell like they're turning rotten, okay, like they've died and been left in the sun for a while, okay, tissue decomposition, when you really shake his hand and his fingers come off, those kind of things, he's dead, okay. He's dead. All right, and then lividity. Lividity is the thing of gravity, where the blood in the body pools to the lowest surface of the skin. If the patient is lying on his back and you roll them over, you might see purple marks all over. These are quite advanced signs of death as well. Okay. Gravity doesn't set in and suck everything to the lowest zone within a few seconds of dying. No, it's a gradual process that develops over a period of maybe an hour, 2, things like that. When you have people that have died on scene, there's a couple of things you need to bear in mind. Okay. If there are any signs of death that are present, consider the patient to be dead. Yes and no. Depends how dead they are. Have they recently died? Is there something? Maybe they've had a heart attack and we can do something to revive that patient. Maybe they've drowned and we can revive that patient. Okay, or had a near drowning and we can revive that patient. Always consider your options very carefully. Okay. Always know what the protocol is with dealing with dead people. And if you have multiple people involved in a vehicle accident or in a situation, always bear the other people in mind as well. Okay, when dealing with a dead person, have respect. Okay, show empathy and sympathy to loved ones that are around you. Okay, try and leave the situation on a positive and not the negative of the people dying. Okay. Negligence is one of those things where it's like abandonment. Okay. Negligence is a little bit different. That there might be a reason that you didn't do what you were supposed to be. You didn't act. Okay. These type of things can be termed as negligence. Okay. It says 4 present conditions must be present. Okay. Duty to act, breach of duty, resulting injuries and proximate cause. If you do something that harms the patient, in the beginning I said do no further harm. If you're going to do something that's going to harm the patient, maybe cause death or permanent injury and things like that, that is negligence. Okay, we can't do things like that. You are going to be prosecuted if you do silly things. One of those things. Now, confidentiality in South Africa and a lot of places around the world, in South Africa in particular, we have what they call a POPI Act, P-O-P-I-A. POPIA means Protection of Personal Information Act. We can't run around sharing people's information. We can't run around telling stories about what we saw, what we did, and who it was that we did it with. Okay, these things are definitely confidential. Patient privilege is a confidential thing. Okay, patient history, our assessment, our treatment, and the communication with the patient is confidential. You may not, under the law, divulge anything like that. Okay. We must always remember, there we go, Health Insurance Portability and Accountability Act. That's the American version. Okay, in certain situations, you may release confidential information, but only to the correct people, doctors, paramedics, police, those people who are involved in the treatment of these patients, the people that are directly involved with the safety of the patient. Okay, now we come to this Good Samaritan law. Now, you must remember, in most of the countries around the world, they have a bit of common law. And not everybody has a common law, but we're having common laws in certain countries. Okay, the Good Samaritan law protects its citizens from liability for errors and omissions in giving good faith emergency care. In other words, if you're providing emergency first aid to somebody that's broken a bone, fallen off his bicycle, whatever the case might be, you see them, you stop there, can I help you? Yes, please. They aren't going to be able to follow you and proceed you and prosecute you for doing something you did. Okay, as long as you acted in good faith, okay, that you acted as a reasonable man would, and that you did no harm, or you didn't set out to do any harm. Okay, you need to be familiar with state laws, regulations, things like that. Country laws, if you're in a country where it's just governed by a central government. Okay, and your certification and registration may be required to work as an emergency medical responder. Just depends where you are. Some places it's good enough to work. So other places you would need extra certification. Okay, but you will always be responsible for keeping your own certificates and your registration current. Okay, reportable events. Okay, these are any type of assaults, knife wounds, gunshot wounds, motor vehicle crashes. Okay, elderly abuse or child abuse, domestic violence. In a lesser degree, dog bites and things like that. And then obviously things like rape and other sorts of forms of domestic violence, both physical and emotional abuse too. Remember, we need to know the areas, rules, laws regarding these things. And don't make yourself a target of things by not reporting things. Okay, if you suspect something is wrong, make a note of it. Okay, if you come across a child that's been abused or something like that, treat the child. Okay, but don't leave the child in harm. Make sure that you inform the correct authorities of your findings for this child abuse. Child and family violence in South Africa, okay, things like that, social welfare in other countries. Obviously with crime scenes, okay, first thing is safety, safety, safety. Our own safety is most important. If you determine that the crime scene is unsafe, okay, don't go to a crime scene, wait for backup, wait for somebody to help you. Okay, your first priority is patient care. Okay, but before that, your first priority is to yourself to make sure you are safe. When assessing the scene, one needs to do a continuous risk assessment, dynamic risk assessment. We would assess the scene, look, listen, think, and act using those things. Look 360 degrees, what can you see? What's happening around you? Listen, what noises can you hear? Vehicles running, crowds shouting, dogs charging at you, want to bite you, things like that. Okay, think about everything you've seen, think about everything you've heard, and then make a decision on this, whether to act or not, and where you're going to act. When you're in a crime scene, remember, touch only what you have to gain access to the patient. If you have to move something, take a picture before you move it. Make sure you've got good quality evidence protection going on there. If you need to cut clothes, don't cut through bullet holes, don't cut through stab wounds, move around them, things like that. Okay. Be careful where you put your equipment down, just don't dump it on the scene. Okay. Keep non-essential people away. Keep the crowds at bay. Hey? Work with appropriate law enforcement authorities on the scene, and consider writing a short report about what you found on the scene when you arrived, and make sure you keep yourself in the clear as far as that's concerned. Documentation is always a very important thing to consider, because these are legal records of your treatment. When we're doing emergency responders, we always do primary survey, secondary survey, treatment for shock, keeping the patient alive as long as possible till the ambulance arrives, hopefully. Okay, we need to make notes of these things. Now, in the old days, we used to have a notebook and we used to write down and draw little pictures and things like that. You have smartphones, smart devices, things like that these days. Make a recording of what you're finding, of your findings. Okay, you can go back and listen to it. You can send it over WhatsApp, you can send it over a Telegram message, whatever the case might be. You can download it and you can store it. Same thing with pictures. Once you have permission from the patient, remember, always get permission for these things, then one could go ahead and take pictures of injuries and things like that for documentation and record keeping purposes only. All right. Documentation we'd like to consider important. The condition you found your patient in, okay. Patient's description of illness and injuries, initial vital signs, your baseline vitals. Those first vital signs you find: breathing, pulse, skin temperature, pupils, blood pressure, if you're able to take it, things like that. What you found when you first arrived on the scene, okay, because these are the things that you would be treating, and hopefully they would be improving the vital signs as time went along. Okay. And you must make sure that you note any reportable conditions.